we understand when we're doing, especially the fall, when children get ill, there's many reasons they get ill. And our first thing is to determine, are they ill from COVID or not? The mild symptoms of COVID are like a lot of others, including, as the minister already mentioned, influenza and other respiratory viruses. So the first aspect, if a child is feeling unwell, one, if the parent knew that, they shouldn't go to the school in the first place that day until they ascertain what is wrong with their child. Second, if it is ill, then we send them home with proper notification of the parent, so they can then undertake an assessment, whether that's through their healthcare provider or their medical history of their child. They know what the situation is. They would be able to take the temperature and do other things that would be appropriate for a parent to do at that time. If they need to get tested, and if their doctor or other assessment center feels they need to get tested, they will get tested. It may be an ear infection. They may have a history of that. So we want to be sensitive to the fact that children don't always get sick from COVID in that. The other factor is we want to be cognizant of what's going on in the community. If there's no COVID circulating in the community, that's not always your first go-to diagnosis. If you have widespread influenza, you need to look at that, and the physicians and primary care doctors and pediatricians would be aware of that and would have that discussion with the family and members in that, and would make recommendations back whether they felt a COVID test was necessary or not. Again, we want to make that decision-making kept with the parents. If it is really in the midst of COVID, then our public health nurse, in consultation with the local medical officer of health, may decide to have some discussion and to request perhaps they would consider getting a COVID test. Each case is different. Each case needs to be approached separately, respecting privacy, respecting where the situation is with the child and the parent at that time. So it's one that we can entertain, but we'll do it in the proper method of clinical assessment and diagnosis to give us the best advice in the right time and to give the direction to the parent with what to do with the child accordingly.